Welcome to the AA Podcast, our little corner of the web where we are not afraid to discuss tough questions like,
when did nutrition, health, movement, and stress management become alternative medicine?
Where we embrace challenges in all aspects of life to become healthier and stronger versions of ourselves.
And where food and movement are the best kinds of medicine, and cooking meals at home is a revolutionary act. Hello, welcome back to another episode of the AA Podcast. This is Ashley Olson.
And I'm Andrea Green.
We are one day out from Christmas. Like, Christmas was yesterday. I cannot believe it.
Seriously.
Like, yeah. New Year's is next week.
I that's too much reality for me at this point in the day.
Yeah, it is insane. Hope you guys had a wonderful Christmas and a blessed New Year, because you'll be ringing it in before our next episode drops.
That's right.
Well, with the spirit of Christmas, our Bible verse this week is going to be from Isaiah 9:6 and part of 7. And as people who are celebrating the true birth of our Savior, this verse means so much to both Andrea and I. And Andrea had this idea that we both read it together, and I love that idea. So here it is. It's Isaiah 9:6 and 7. For unto us a child is born, unto us a son is given, and the government will be upon his shoulders, and his name will be called
Wonderful Counselor, Mighty God, Everlasting Father, Prince of Peace. Of the increase of his government and peace, there will be no end.
Love it.
All right, girls. So today we are talking about some things that definitely need a qualifier on them, and I will give those probably pretty frequently as we go along. But we're talking about signs that you may have nutrient deficiencies, and nothing makes me happier than to walk up to somebody and say, hey, you're not getting enough protein, because generally they're not. So
which, if you haven't already, we have a whole episode on that.
That's
so
right. That's
actually
right.
2-part episodes, so go check that out. But this is funny. So when Andrea and I first met, like probably the first 1 or 2 times that I met, she's just coming up and like poking and prodding me and like looking deep into my eyes. Like, I'm like, dude, like, give me some space. Stop thinking everything is wrong with me.
Oh my gosh.
And so,
that's really funny, Ashley, because Ken says the same thing about me. He's just like, quit staring at me, quit looking at me. I know you're trying to diagnose me, and I can't help it. It's just,
it's bred deep into your bones.
It really is. It really is.
So I love it. I really wanted her to do this episode because these are just some very simple things that we can look at on ourselves and see, hey, maybe I'm deficient in this area, and I didn't realize that XYZ was a sign of XYZ. So, we're going to walk through these things. Well, Andrea is really, but I just want to emphasize that these things are just so, like, they're so basic that you can do for yourself. And then there's just some very basic things that we can do to improve them. So, where do you want to start, Andrea?
Well, I thought we would probably start with hair. Hair is a big topic of interest these days. In fact, I have lots of patients that come in and their chief complaint, like, they may have raging disease states going on, but especially for women, they come in and, man, if their hair's falling out, that is, and I feel that too. When my hair falls out, like post-COVID, gosh, it's really disconcerting, and you want something to make that stop, because you're just thinking, oh my gosh, one of these days I'm going to wake up and it's going to be the last hair.
Exactly.
Yeah, I don't know if it's coming back. So yeah, I wanted to talk about nutrient deficiencies that can show up in your hair. Now here's here's a blanket qualifier. So all of these things that I'm going to mention today, they're super fun to look at people and to look at yourself and to say, oh, I could have this, or I could have this, or maybe I need to eat more of this. However, I just want to say that there are also some more serious underlying conditions that I'm not necessarily going to talk about all of them today. Otherwise, we'd be here for hours. But there are some underlying things. So if you like go ahead and do all of the what I call low hanging fruit things, and you're still having issues, or if you're having these issues and you haven't been seen by primary care for quite some time, I would say go in, just get some blood work done, go in. I'm thinking about the panels that I order on my patients annually. These are annual labs that I look at, because I want to know what's going on year over year. And if you're not being seen by anyone, then it's hard to know what's going on with your health, because the signs aren't always overt when you're developing a disease. So, anyway, that's my qualifier. So, let's start with hair. So this sign is in particular long hair that is not colored. We obviously can't see this sign. I'm talking about bands of hypopigmentation. So sometimes you'll see in someone that has fairly long hair, I'd say shoulder length or longer, you can look at their hair if it's not colored and almost see these bands of lighter color throughout their hair, and they'll be horizontal bands. Now, that is often a sign of a protein deficiency. Um, and a lot of times this comes from times of stress or illness, where you have these protein deficiencies. And in other countries where they don't have food as plentifully as we do, you can definitely see this during periods of malnourishment. You can see these more pronounced bands, but we can see it here in this country as well, because while we've got plenty of calories around, we don't always have plenty of protein.
Mm.
So the next one, this could just be a genetic thing. So I'm talking about sparse and thin hair. So if you feel like your hair is really sparse or thin, one, my first question would be, well, has it always been that way? And if it's always been that way, then chances are this is a genetic predisposition rather than a nutrient deficiency. However, if you say no, it's never been this thin, it's never been this sparse, then I'm going to start looking at like protein, zinc, or biotin deficiency. And I want to say a word about biotin. So,
Mm-hmm.
everybody is taking biotin now, especially after COVID hair, right? Because COVID makes your hair jump off of your head. Um, and so everyone is taking these formulations that have tons and tons of biotin in them. So, couple things about biotin. One, it can cause some acne issues
Mm.
to pop up that you may not have had for a long time. So, if you're 30, 40, 50, and you haven't had a pimple in, forever, now you're taking biotin in your face is a mess. And that's probably why. Also, biotin will really jack up some labs. So there are lots of very important labs that we run that are really thrown off by biotin. So rather than going into all the details on those, I'll just say stop all supplements 48 hours before you get labs drawn. Biotin in particular is a real wrench in the system. So
That's so interesting. I had no idea.
yeah. Yeah, and I'm seeing it so much more now because of, because people are losing hair.
Now, this may be a little off topic, but do you know either short or long-term negative or positive effects? So one thing that I am seeing that Instagram influencers are pushing a lot is Nutrifoil.
Mhm. Mhm. Okay. So it's ridiculous. Just like the what is it? Oh gosh.
Colostrum.
Yes, yes, yes. Yes, and I don't want to mention any brands, but anything that you are pushing,
It starts with an A.
right? like my name. It starts
Yeah.
with an A, it ends with an A.
It actually has a
Um,
double
yes,
A.
it does. Yes, it does. But yeah, anything you're seeing like that, just overlook it. you don't
Yeah.
you don't need the fancy stuff. And honestly, if you eat enough liver, you're getting plenty of B vitamins. Like
Mm.
if that's
So is that what that is pretty much?
Mhm. Yeah,
Okay.
it's going to be some pretty concentrated B vitamins. It's going to be it'll be some other stuff in there too, I'm sure, just to kind of round it out. But it's going to be a lot of folate. It's going to be a lot of. It's basically like a glorified prenatal vitamin.
Okay.
Yeah,
Yeah.
that you don't need to spend a lot of money on. That's
Mhm.
it's ridiculous. Um, yeah, so this idea of hair falling out, and I've mentioned COVID several times. It doesn't necessarily have to be COVID. There are times of illness and great stress on the body that also make hair jump off your head, and that
Mhm.
condition is called telogen effluvium. And it's like a post-infectious or a post stress on the body, and it's just part of that. It's like a lagging effect that happens after a time of great stress or illness, and that will go away.
Mhm.
Yeah.
Yeah.
So the other thing with hair falling out, we always want to look at thyroid. We always want to look at iron. So if we are catching so much anemia at my practice, people's ferritin levels are just in the tank. And
Why do you believe that's is?
gosh, I was just gonna say, I'm not exactly sure. Because I haven't been in practice for 1,000 years, I don't really have like I can't
Trends.
yeah, I can't look back and say, oh, we never used to see this or this, but I know we've been checking, like we, the royal we, right? Medical people have been checking ferritin for a long time now, and we've known that that heralds iron deficiency. So yeah, I just I think it's a widespread problem. I think it's probably due to chronic levels of inflammation.
Mm.
Um, and yeah, but we need to replete iron at that point.
Now, is iron one that you should get your levels checked before adding in a supplement, or is it
Hmm.
fine to start adding in a small dose?
That is a great question, and I would say get your levels checked. In fact, if you do like a super mini anemia panel, all you need is a CBC and a ferritin.
Okay.
And then and insurance shouldn't squawk at any of that. And in fact, if you need an ICD-10 code to go along with that so that they'll pay, you're fatigued,
Mm.
and they will say, well, that is definitely within the range of possibility that their provider is looking for anemia, so yes, we're going to pay for ferritin, we're going to pay for that CBC. Otherwise, you can order it yourself from labs like Ulta that I think we've talked about before. um,
Mhm.
and it's like I don't know, like $20, so it
Yeah.
should be a really inexpensive test. So, yeah, if your ferritin's less than 70, and your hair's falling out, then yeah, we need to give you some iron. There are formulations that will bypass gut absorption. One of those is called Easy Melt, and they're starting to make several supplements. I need to look into the company a little bit more, but for right now, I really like the idea of a sublingual or transdermal formulation of iron. So you literally just put it in your mouth, you let it melt, and then take it away from dairy.
Say that again because I don't think I processed that.
On the melting iron.
Okay.
Yeah, so it's like 18 milligrams a tablet. They're called Easy Melts. You can just get them off of Amazon,
Okay.
and you just pop one in your mouth, and it melts, and it will absorb across that sublingual vasculature. If you flip your tongue up, there are huge vessels underneath there, and so it will get right into your bloodstream and avoid the GI absorption.
Okay.
Not 100%, but it will absorb a lot of it. Um, and so, yeah, that's I think
And
that's
then
a
you said
great way.
something about milk.
Yes. So, iron is super fussy, super fussy. It does not want to absorb. The body doesn't want to absorb it, even though it needs it. Um, and milk will impair the absorption of iron.
Okay,
So
so avoid it.
yes, I like to tell people 90 minutes away from any dairy.
Okay,
Yeah.
very good.
Mm. Oh, there's also this weird phenomenon of like people know if they have this. It's almost like it kind of looks like a duck head. You know the shape of a duck head where it kind of goes up and then out for a bill.
Uh-huh.
It's this weird kinked hair, and you know if you've got them. It can also look like a corkscrew or a coiled hair, but they don't look like all the rest of them. They're just kind of here and there. That can be indicative of a vitamin C or a vitamin A deficiency. So if I've got people who have these, I go for vitamin A first because people generally will get enough. Now I say enough, they will keep scurvy away with the
Mm,
level of vitamin C that they're getting. But usually people are not getting enough vitamin A.
very
How
interesting.
do you know how we get vitamin A, Ashley?
I don't.
Okay. So, my absolute favorite, it's my desert island food. It
Oh,
is
beef liver.
beef liver, yes. Or if I can't sell that, then I will suggest cod liver oil.
Ah,
Ashley Olsen.
yes.
Uh-huh. Yep.
And we've talked about it before.
Mhm.
Nordic Naturals, cod
Yes.
liver oil,
Yes.
orange flavor. I
Yes.
swig it and it's totally fine. It
It
does
is
not
totally
taste
fine.
nasty. And I am Miss Picky when it comes to things like
Yes,
that.
you
So,
are. So if she can do it, you can do it.
yep.
Right.
So
Your hair is at stake here, people.
I know.
So just trust us. Um, all right.
Yeah. So next one is nails.
Nails, yes. So, oh, I would be remiss if I didn't like at least put in a plug for collagen. I'm a huge collagen
Oh,
fan.
yes.
I've been drinking collagen for years and years.
I'm
I
drinking it right now.
are you? I am too. Yeah, it's in my coffee right now. Um, I am a huge fan of collagen. I think it strengthens hair. I've got a lot of hair, and I attribute that at least in part to collagen. I've had COVID. Oh my gosh, I've had COVID 3 times. It's pretty much a non-issue for me physiologically, but I do get that telogen effluvium post COVID, and so I do get some hair loss afterwards. That can be a little startling, but
Yeah.
fortunately, I am still left with a full head of hair after it's over. So
And
um,
I can attest, like,
mm,
since taking collagen, like my hair has never been better
mhm.
and my skin looks better.
Yep.
Everything is just
Nails
better.
grow
So,
faster, like,
yeah.
it's all good.
Yeah.
You do have to get haircuts a little more often, but that's a good problem to have. So
True that.
yep. All right, let's move on to nails. So nails, oh my gosh, you guys, your nails will tell you so much about the state of your nutrition. And the cool thing is your nails grow out in like 6 months. So like from the base of the nail, there out to the very tip will take about 6 months. So if you've got something, let's say you have an injury and you got some bruising underneath your nail and it's growing out,
Or
and
maybe you chopped your
or
finger
maybe
off.
chopped your finger off while doing yard work. Ashley, care to tell anybody about your regrowth?
Oh my gosh. That's probably a whole nother episode.
Right.
Um, yeah, I was using some electric hedge trimmers and I
Mm.
hit a branch and my hand slipped forward and completely chopped off half the tip of my middle right finger.
Whew.
And we had no idea if I would have a nail again or what it would
Mhm.
look like. And I totally attribute, well, multiple things, but just being very diligent about
Mhm.
collagen, zinc,
Vitamin
D,
C.
vitamin C. I did some, it's that green stuff.
Oh, spirulina. Didn't
No,
you didn't take
I,
spirulina?
d- No, I did Manuka honey.
Okay.
Um,
Yeah,
oh,
there
I'd
were.
have to go find. I did a whole slew of things, and if you looked at my hand today and didn't look super close, like you wouldn't know any different.
Mhm. Yeah, you did an incredible job, of just making sure that your body had
I was a little
ex
desperate.
well, yeah. I mean, it was a significant injury, people. Yeah.
Yeah.
Anyway, they were good
Anyway,
pictures. They
yes.
were pictures that an ER nurse would keep. So, if that tells you anything. They were good. All right. So nails. So if we see that point of injury, that bruise or whatever, let's say that it's halfway down the nail bed, then we can say, oh, that occurred about 3 months ago. So you can
Okay.
kind of tell when the injury was if it grows out. Now, if there's something going on in your nail and it doesn't grow out, then that means there's been damage to the actual nail bed, and so that can mean other things. It can mean a traumatic injury. Um, it can mean lack of oxygen, like a hypoxic injury. But anyway, it all tells us something. So let's. One of the things that I like to look at, is oh, one more thing I'll say about that, as we're just perusing the nails and just having our like overview of them, if there are places that look weird on your nails but it's only on one finger or it's only on one hand, generally I chalk that up to an injury rather than like a nutrient deficiency, because those theoretically we should see on both hands, right? It shouldn't discriminate between one hand or another. um
Yeah, like today I see like what you would probably I think are considered like nail bruises, like the little whites, but like that's just like
oh,
hitting
it can
things.
be, yeah.
Yeah.
Are you having white spots on your nails?
Yeah, but like I can literally tell you it's probably from hitting dumbbells.
Yeah, that could
But it like
definitely
it's
be.
only on one hand and
Okay.
maybe a couple
Okay.
fingers.
Is it your dominant hand? Right
Yeah.
hand? Okay. Yeah.
Yeah.
Yeah, probably an injury.
Yeah.
um so that brings us to white spots, or leukonychia punctate. The
What did you say?
the I know. The plural is so funny. It's leukonychia punctata.
Oh
So,
my gosh.
Hakuna punctata, right? Um, so this is, a lot of times this will be due to a zinc or some other micronutrient deficiency. However, my my rule of thumb is to always go with the simplest explanation. So Occam's razor, right? The simplest explanation will generally suffice. So it's kind of like if you hear hoofbeats, it's probably a horse, not a zebra. So that's an example of Occam's razor. So white spots on the nails. Again, if we rule out injury, Ashley throws dumbbells around all day for her job, and so she would Occam's razor says that those white spots are likely due to injury rather than a nutrient deficiency. Plus, they're on her dominant hand, they're unilateral, et cetera, et cetera. So, but if I see these little if white spots on nails, or if you look down at your nails and you see these little white spots, could it be a micronutrient deficiency? Absolutely, it can. Of which zinc is going to be the most common. So, zinc is a great thing to take this time of year anyway. It's very immunosupportive, and so I would tell folks, hey, throw some zinc in there and
Mhm.
see. But keep in mind, nails take 6 months to grow out. So if you got a white spot like halfway up your nail, it's going to take another 3 months before that grows on out. So
Mm.
don't don't think that the zinc didn't work. It's that, your nail is still growing out.
And if you didn't catch our episode last week, we talk all about what you should be taking this time of year,
Mm,
especially with cold and flu season. So there's just
yes.
a little plug for that.
Yeah, absolutely. And I think I said there, and I'll also say here, I like to pulse sync. I don't like people taking it all the time. And so if you've got nails, then you can do that 3 weeks out of the month. The next one is the lunula. That is the like little half moon, little white half moon at the base of your nail. You should see that on all of your nails. If the nail if the lunula is not present, or you can't distinguish between the rest of your nail and the lunula, then you should be on the lookout for a potential anemia.
Hmm.
Uh,
So I have it on my thumb, pointer, middle,
hmm.
but my ring and my pinkies, I can't
You
see.
don't see a lunula at all?
Mm-mm.
Okay, so then I would start looking for other signs of anemia. I would look at I would pull your fingers back, and I would look and see if the lines in your hands are beefy and red. If they're not, it's so funny I get to see you on camera. um yeah, so anyway, if you like pull your fingers backward to stretch the skin over your palm tight,
Like this?
you got it. Then
Okay.
if those lines in your hands are not real beefy red, then
They are very red.
they're very red. Okay, then anemia is probably not your problem.
Cool.
You can also look at the skin right next to your eyeball, kind of pull down your lower lid, looking at that skin next to your eyeball. If it's real pale, that can also be a sign of anemia.
Okay.
Yeah. And so beefy red nails. So if they're like, if you look in the tissue underneath, this is not very common, you guys, but if you look and your the pink part of your nail is real beefy and red in that nail bed, that can be a sign of polycythemia. That's a condition, generally genetic, sometimes medication induced, where your body is creating too many red blood cells, and sometimes you need to have those drawn off with like a therapeutic blood donation. I've got lots of patients that either have polycythemia or hemochromatosis, and they need to donate blood periodically to get those extra red blood cells off. But that's a dark red. Now, if it's a bright, bright cherry red and you have real cherry red lips, um, that can be that can be carbon monoxide poisoning, and that is a medical emergency. I want you to go straight to the ER, please. Where they will fix you right up.
Okay.
But yeah, if you're seeing that, you need to get out of whatever location you're in. We don't want any cherry red lips.
And this is your reminder, folks, to
Right.
change your batteries in your carbon monoxide.
Your public service announcement. If you can still make out what we're saying. Oh, that's terrible. Okay. All right. So the next thing I want to look at with nails is pits, like these
Oh yeah, the
yeah, the little
indentions.
indents. And these will look like almost like somebody took a tiny little ice pick and just dotted the surface of your nail. So generally, so again, the horse hoof beats on this would be an autoimmune disease, and historically psoriasis will present this way on the nails. um and so yeah, if you have psoriasis, is probably not news to you. Your nails probably look like this, but in somebody that's just developing the disease, it may not be as overt on the skin yet and may be showing up on the nails. So the next one is clubbing. So clubbing, this is also a sign that needs to be checked out immediately. So people with COPD, with obstructive breathing disorders, who are kind of chronically hypoxic or chronically in this low oxygen state, they will develop, gosh, if you want to see what this looks like, Google images for clubbing of nails. And it literally looks like like a big bulbous kind of protrusion on the end of the finger. You see
Oh,
that?
I've seen that. Yeah, yeah, yeah,
Yeah.
yeah.
And so that means that this person is chronically lacking in oxygen, so much so that their actual physiology has changed on the surface of their fingers, or on the lateral tips of their fingers. So yeah, so any clubbing it could be from, oh my gosh, there's like 5 or 6 different body systems that you need to rule out, for why is this person hypoxic? Why don't they have enough oxygen? So the first thing that you would do is run some blood work and see if they're anemic. You evaluate them for COPD if they're a long-term smoker. Those kinds of things will absolutely compromise oxygen.
So
Um,
interesting.
yeah.
So, if that is something that you're noticing, what can
hmm
you do? Like, is that where
Yeah.
you do hyperbaric chambers or?
Oh, well, one, if it's anemia, then you need to correct the anemia with your
Okay.
provider.
Okay.
Also, two, COPD. These are probably the most common causes. I mean, gosh, the list of differentials goes all the way to lung cancer, goes all the way to kidney disease. I mean, it's just replete with conditions. But this needs to be evaluated by your provider if you see clubbing.
Okay.
And then, okay, so this is a favorite, spooning of the nails, and we can see this. Um, the nails will actually, so if you look at the tips of your nails, and this is always hard to describe, but if you look at the
Mm,
tips of your nails, like point your fingers back at your face and just look at the tips of them. And then you can see your nail, and you want a really pronounced curvature of that nail. So if that nail is flat, or if it's starting to spoon the other way, almost like you could hold a drop of water on the tip of your finger, right? Because your nails are spooning. They will be flat first and then they will spoon. So this can be, it's usually an iron deficiency, but these folks are almost always deficient in protein as well. And so I always recommend, well, liver, of course, because it's got tons of bioavailable iron, along with 50,000 other things that you need. But um, red meat, iron supplement if necessary, but you always want to get that CBC done. You want to get that blood work done. You want to get that ferritin level, because it can also be a sign of too much iron in a condition like hemochromatosis. So, um, I had a patient the other day, and she had some pretty pronounced flattening of her nails. And I said, "Oh, this is generally due to an iron deficiency." And she laughed and she said, "Well, not in me, because I have hemochromatosis." And I'm like, "Oh, okay. Well, that can absolutely be the other reason." So, um, and you want to get that right. You never, never, never want to give somebody with hemochromatosis extra iron, because their blood gets thick, they can throw clots, it can be a very dangerous situation. So just get in for a CBC and a ferritin level. Also, what you can do is eat more protein and eat more heme, and see, if that helps fix things. The other thing, there are these transverse lines that run, and that can often be attributed to a protein deficiency. Again, there are other things as well. Could be dehydration. The ridging in nails can be dehydration. Um, but if it's long term, then I would look more at protein deficiency. Also, fatty acid deficiencies. And this is the
mm.
good fats. This is the cod liver oil, the fish oil, the salmon, the mackerel, the sardines. Yes, we love sardines. Well, um,
Some people do.
love is a weird word to use with sardines. But yeah, protein deficiency, that's what I always go for first, and then we'll replete, fatty acids and stuff after that. So, now, did you want to break this into 2 episodes? Because I think we're nearing our time.
Yeah, I think because the next two, I mean, I think it'd be beneficial for just listening purposes if we broke
hmm
it up into two. So,
Okay.
yeah, why don't we make this a two-part series?
Okay.
This was super interesting. I think the nails is just like a it's just like a fascinating one because it's something that you look at every day
Yeah.
pretty much.
Yeah,
And
exactly.
and especially for women. I mean,
hmm
so another thing too is if you are thinking like, "Oh, I get my nails done all the time because I
Right.
hate how my nails look.
Yes.
Maybe give yourself a break from getting your
Mm-hmm.
nails done to be able to look at these things.
Mm-hmm.
Because yeah,
Well, and another thing I'll mention is these nail hardening um, formulations that you can paint on your nails. They work, and
yes.
they're great, but if you use them long term, they can cause your nails to dry out and start to flake and break.
Yes. When I was getting my nails dipped all the time, because that
Mm-hmm.
actually has a hardening agent in them,
Oh.
um, because people were like, "Oh, my nails just feel so much better. They're so much stronger,"
Mm.
because it has that hardening agent in it. But,
Yeah.
when I stopped doing them, like, my nails were not good for a while because they had to
Mhm.
recover.
Oh, yeah. Yeah, it probably
Yeah,
took 6 months. So,
probably.
yeah.
Yeah.
All
Well,
right.
yeah, we will catch you on the next episode. We're going to talk about the skin and even the mouth and tongue in our
Mhm.
next part, which the mouth and tongue is also a very interesting one. Um, so we will break this up and we'll catch you on the next one. As always, if you found this episode interesting, informative, whatever,
Delightful.
entertaining, yes, delightful, please give us a rating on whatever platform that you are listening on. That just greatly helps get the word out. But the biggest compliment that we can ever receive is sending this to your friends and family or sharing it on
Mhm.
social media. So we would most definitely appreciate that. So, and as always, if you have questions or comments about any of the episodes that we have, please send them our way. Our contact information is in the show notes, and we will catch you on the next episode.
Bye, everybody. The content provided in the AA podcast is intended for informational and educational purposes only. The podcast is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The information and opinions expressed in this podcast are solely those of the individuals involved and do not constitute medical advice.